I'm Dr. Darrell Brett. I'm a neurosurgeon specializing in spine surgery. I practice in Portland, Oregon. Patients that I see with symptomatic spinal stenosis have usually been to other physicians first, their family physician or their chiropractic physician, and are referred to my office. Well, I think the patient, after having pain for months with conservative care and having tried everything else, the chiropractor and medication, whether it's epidural steroid injection or oral steroid, they realize that, well, I'm going to need to have something done. It's a matter of reassuring them that things have changed a lot in surgery. It's very common for patients to ask to avoid a fusion. And not that many patients have heard about Coflex, but typically I'll give them the brochure, the website, coflexsolution.com. I think the Coflex is a very attractive option for surgeons and patients to avoid a fusion, maintain movement at that segment, and it's safe and effective, much less downtime. We often do these as outpatients, and quick recovery. A patient in the past would have been looking at a fusion, which is a pretty big operation. The Coflex device will help patients to be treated sooner and just for society to have less time loss from work, greater productivity. So we know as surgeons when we fuse in the lumbar spine, especially if we fuse 2 levels, the level above is going to undergo accelerated degenerative change. And so that's the key, the most important thing about motion preservation is preventing that adjacent level disease. Over 200 patients that I've operated on with Coflex now, they heal well. Of course, the new study that came out in January of this year from Germany, a 2-year double-blind prospective study, showed that the Coflex can be done safely. It has a better result in terms of pain relief and has been shown to preserve foraminal height and posterior disc height. I think it's exciting for patients that have spinal stenosis. They can have their symptoms alleviated and have the durability and longevity of that decompression. In my own experience, I actually had spinal stenosis 3.5 years ago. I'd had an MRI on my back because of some back pain and a little bit of discomfort into my left leg. But the radiologist had noted that up at L2-3 I had spinal stenosis developing. Having made the decision to go ahead with surgery, I did not want to have another operation, if at all possible. I mean, I wanted to have a permanent, complete cure of my trouble with a relatively safe operation. So I just was not going to have a fusion. At that point, I had done the Coflex procedure on about 44 patients in my practice, and my partner had done maybe 10 or 15. Just on the basis of my experience with it and the studies that had been done that showed it could be done safely, I elected to have Coflex in my own back. I'll never forget when I woke up after surgery and got out of bed for the first time, and I stood up and did not have that pain in my buttocks, and I knew that I was cured. So that was a wonderful feeling. I think Coflex for me it came along at the right time in my life, and I'm glad it did. But in terms of playing golf and my snow ski and all the activities that I enjoyed before, I'm doing now. My strength is back in my legs. In retrospect, I probably should have had the surgery done sooner, but Coflex has been a great solution for me, and I'm glad it's available for my patients.